Well, public safety extending to health as well. This week, Health and Human Services Secretary Robert F. Kennedy Jr. dismissed the entire panel of CDC vaccine advisors, the people who guide the federal government's vaccine recommendations. Kennedy has said that the 17-member group will be retired and replaced with new members. He does have the authority to appoint and dismiss members, but removing the entire panel, that's unprecedented, as they are not political appointees. That board made up of physicians, including pediatricians and immunologists. Dr. Noel Brewer was a voting member from North Carolina.
It was deeply surprising. No one really saw this coming. There were some questions about some members who had had their status become inactive for periods of time because of administrative problems, but this is really very surprising to all of us.
Joining us now to discuss is Dr. Vin Gupta, a leading pulmonologist and NBC medical analyst. Doctor, thanks for joining us.
Thanks, Joyce. Good evening.
So first, how does removing this independent panel affect credibility of vaccine recommendations across the country?
Well, Joyce, factually speaking, when the Secretary of Health comments on the conflicts of interest of the experts that are on these panels, on ACIP specifically, the Advisory Committee on Immunization Practices, he's factually incorrect. These are 17 experts spanning the fields of pediatrics, epidemiology, public health, infectious diseases. Our own Dr. Helen Chu of University of Washington, an ID doc, is on this esteemed panel. These are experts, and they have to make their conflicts very clear. And it's, by the way, forbidden for them to own stock in a vaccine manufacturer or any pharmaceutical company for that matter. And so he's wrong when he's claiming that these experts have nefarious intent or that they have conflicts that they are not disclosing. It's completely factually incorrect. And so who knows who we're going to get is the concern in ACIP 2.0. But my worry is that they're going to be just like him, coming from a history of not pushing back on health information, of embracing vaccine skepticism. And that's a really, really dangerous precedent. And we're headed to a really dangerous place.
And public trust is already pretty fragile when it comes to vaccines. So how could this impact vaccine hesitancy, especially for parents who've traditionally been encouraged to follow immunization schedules?
Well, I worry about this having a detrimental impact to preventable illness. I think of all the infectious diseases for which we have effective vaccines for children all the way up to elder adulthood. And the concern here is if people are not clearly told that they are recommended to get a vaccine, say a flu booster or a COVID booster, then they're going to start to have questions, understandably, because it's going to create confusion. For doctors, I've spoken to doctors across the country, Joyce. There isn't a single doctor I've spoken to, and I speak to many, in societies like the American Academy of Pediatrics, who in any way appreciates or is embracing what's happening. I can tell you there's a lot of outrage and anger from the medical community across the spectrum. I'm talking about 90+% of people that hear what's going on are not happy with it because it's only going to make all of our lives when it comes to patient care much more difficult. We don't have enough hours in the day to be able to counsel patients, do shared decision making, and have the conversations Kennedy and his team are saying we should be having at scale. And they know that. They know that it's difficult to have these conversations at scale, and it's their responsibility to provide clear recommendations. They're just making our lives much more difficult.
So what are the potential health risks if vaccination rates drop because of confusion or skepticism because of this decision?
Well, for example, we've seen children's hospitals, the number of physical children's hospital beds across the country during the pandemic actually decline. There's less of them physically than there were, say, before the pandemic, because it's a tough business. It's tough to stay in healthcare. Hospitals across the country are consolidating. Right at this moment, as we have less ability in relative terms to care for, say, children that might need hospitalization, here we're talking about decreased vaccine rates, all these threats to vaccine rates, posing significant risks to communities across the country. But especially I worry about children because, again, we don't have a lot of spare capacity in the health system to care for a surge of preventable illness for kids, much less adults. ER is already swamped. There's a healthcare workforce crisis. We don't have enough actual human capital, Joyce, to care for the rising demand in healthcare needs. And yet here's something that we control. That's an off-ramp that can help us care for those that actually need to be in the hospital. And well, what are we doing? We're actually making things a lot more difficult. We're making our lives needlessly much more difficult when we're already facing serious challenges. What I'll say is many things can be true. Our American healthcare system has problems. No one in any way doubts that. It's also true that the vaccine committee that RFK retired, quote unquote, was not a problem. We need to be focused on the actual issues here.
Dr. Vin Gupta, thank you so much for helping us to understand this. We appreciate your time. Thanks.
Thank you.